Hi everyone, thanks for joining. We're going to get started now. 30 minutes, one question, one follow-up, and Dr. Williams is here, so I'll turn it over to him for some brief remarks.
Hey, thank you. Good afternoon. It's Monday, so we're looking back over the weekend to see how did we do. And, excuse me, and so we've seen some numbers go up and down. We're around that 100, just over 100 for the past number of days. In that, we haven't really jumped up to our mid-150s in that area there, which is encouraging. And our testing has remained fairly robust over that time. So we did see 108 cases on Saturday, 115 on Sunday, and today 105. And our total thus far is 41,507. Most of the health units are reporting less than 5 cases, 19 reporting no new cases at all. So that tends to stay down. Of our 100 cases over the time, we usually see them concentrated 1 or 2 either health units or larger city centers in that, and they tend to fluctuate up and down. Most of the 100 we've have in today's are in Toronto, Peel, and Ottawa. The testing capacity has stayed well over 20,000. Today it's 18,790, which is usually what follows our pattern because today's represent what was submitted on Saturday. And we follow that, and we'll see some tests maybe down, slightly up again tomorrow, and then picking back up as we go into the new week. So, so we're in this process, what we call, I think Dr. Tam used the phrase, but I think we like to say we coined it first. You know, Dr. McEwen at the Public Health Measure Table saying we're in this time of slow burn, which means instead of peaking down and coming down really fast and going down to zero for a while, and then seeing as some of the other provinces and territories start to have a resurgence, we're in this phase of plateauing around between 100 and 120 at that level there, once in a while dipping down, as we said before, below that, but that was one time due to data entry issues and popping back up again. What does that mean? And we talk about slow burn, and where does that come from? It's basically from a forest fire analogy, and having been from the north, once one's finished with a forest fire in the large front, the work is not over, it just starts to begin. And people go back and check and recheck because you get smoldering stuff that all of a sudden can erupt into little fires here and there, or they can get back up big again. So one has to go about that work diligently. It's a bit of a lot of slugging and monitoring and checking it out and moving in to unearth what's there and get the fire zone that's underneath the ground sometimes put out. So there's extra work involved, but that's part of the due process. What we're seeing with the health units is they're going out, they're finding cases, but instead of saying, oh, it's 1 or 2 cases, but it's in a building, it's in an institution, it's in a group, and then we check it out and we say, okay, the rest of the people, even if you have no symptoms, you're going to be required to get tested. And you go and find a place that has 1 case, like a farm, and you end up with 20 more because they weren't going to come get tested, but you're asking them to get tested. So we're, in a way, beating the bushes, if I can use that analogy, looking for those cases rather than letting them come through as they wish. As a result, then we're going to continue to see those numbers jump up in some of the cities and that, because if an outbreak is 10, 20 people, add to your background, you're going to be over 30 or 40, and that means then the number jumps up for the province. But all you need is 2 or 3 places like that, and you're up to 100. So in a way, I'm not perplexed by that number staying around there. It's reassuring because it tells me that the so-called firefighting function or the outbreak management and searching is continuing assertively by the health units in each of their respective jurisdictions. That means then the actual number spread through the community that we don't know they're allocated to is dropping and dropping. The only limitation there is sometimes when you ask people who come up with positive, they can't recall travel, they can't recall contact, signs or symptoms, and you're left trying to think, okay, where'd they get it from? Because they got it from someone, somewhere. And it's a matter of trying to recall that and bring that out. That's important as we try to finish this 3rd week of stage 3 widely open. As you know, when we decided to go to stage 3, first with one group, then another group, and finally with the whole province, there was lots of apprehension that this would quickly escalate back into big numbers up into the 200 and 300s. The good news, we have not seen that. What does that mean, good news? That means for the Ontarians, who people are saying probably would not be able to maintain the public health measures, you did maintain those measures. Does it mean everyone did? No. A large proportion of the people have taken this and continue to take this seriously. And for that, I applaud the Ontarians who continue to do that in all age groups. I would include some 20 to 39-year-olds. that, as I said last week, while they have had a percentage increase because the others have dropped down, their numbers have remained in a reasonable level, but still represents that all age groups, there's some individuals who choose to say, I don't think it's worth bothering with, and that's a bad conclusion to make because it could affect you and impact you if we're going to bring this number down even lower in the future. It also means we want to have our community levels. If it's in a certain bar or in a certain farm, that means generally for your school children returning, it's not an important issue. So you want to make sure we can reassure parents as they go into the September period of time. You have to watch two things. What is preparation for you? No, three things, sorry. What is your preparation personally and that of your child? What is the preparation for the school that's happening where your child is going to be attending? And second, what's happening in your community? Because that's just as important. So you want to be informed on all three fronts. And we're working on different methods to put all those things in place, as you can imagine, with over 72 boards and with that many number of schools, both elementary and secondary, and with close to 2 million students, is a challenge to make sure all things are in line with our public health measures being instituted and IPAC in schools. So there's a lot of work going on as we prepare to do this in September and to deal with the fact that our children need to be back in school for their education. Some are going to choose to stay out, and how do we make sure that works well? That's really up to the Ministry of Education and how you work with that in a centralized or decentralized way. So we're working with strong partnership with the Ministry of Education and with the deputy there as we work on putting aspects out, our public health measures team, the local health units and the MOHs all coming together as we seek to get our things in place to monitor, document, educate, inform, and keep up to date the schools, the staff, the students, and especially the parents, that they know what's going on in our schools, what's going on in our community. Both, as I said, are important. So that's generally the aspect we're dealing with here. We'll continue to monitor the situation as far as our outbreaks are concerned and as far as getting prepared for school opening, not just elementary and secondary. We're also concerned about our post-secondary schools as the universities come back together. And we've already heard excellent ideas of what they're going to do with, I would say, an atypical frosh week and how they do those activities. And we hope they will maintain that vigilance and diligence at that level too, where sometimes the behavior gets a little bit outlandish, as we've seen in some before. And while it may be humorous, I think this time this year we're going to have to be extra careful. And what are those things we're going to set in place there? Because we don't want to see that curtailed and problems arise in our post-secondary school institutions as well. So we would like everybody to have a different school year, a safe school year, and a productive school year. So with that, I'm going to hand over to the media for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
First question comes from Mike Crawley at CBC News. Please go ahead.
Hi, Dr. Williams.
Hi, Mike.
You mentioned briefly the relatively large number of cases happening among people in their 20s and their 30s. Wondering what the province's plan is going forward about trying to communicate differently with the people in their 20s and 30s, trying to get some sort of a message to them about the need for better preventive behavior?
So I don't think you're on Thursday, Mike, when I was talking about this one here, and I think it's a very good question. I've looked at our data throughout the whole period, and of course, during the time when we had most of our cases were in long-term care and retirement homes, the percent involved in that were mostly those over the ages of 80, over the ages of 70, and that was to be understood. I looked at then as those dropped down, as we brought that under control, their levels of exposure have dropped and come back down. What you see is that all the way through, the younger age groups in the actual absolute numbers did not fluctuate too much and stayed down at that level. As that other group dropped down, the percent of the positivity, instead of dealing with 300 to 400 cases, 200 cases, we're dealing with 100. So that changes. So the absolute number is not big. Nevertheless, the proportion, percentage-wise, that are related to outbreaks in situations is increasing. And that shows you that there's some in that group, not the whole group writ large, and because I want to make sure that we're not saying that that group as a whole group is less than responsible. It looks like a number have been responsible throughout the whole outbreak. Nevertheless, there are some in there that are choosing to get more casual about it, and assume that since it's not a big deal, can we just throw caution to the wind, have large gatherings, go to different groups and activities? And the answer is no, you can't. And that's especially going to be important as we go into the post-secondary school institution opening, and we want to be cautious with that. So we're trying to look at different strategies to say, what is the outbreak modality? Is it the group writ large, or is it certain groups and certain activities in certain places that we have to come in very firmly saying, you shouldn't have done this and you should be more cautious in this? You can still do some activities with public health measures in place. So it's not that you can't do everything. You can do most things, but you can do them with caution rather than throwing caution to the wind. So we want to be targeting our messaging very carefully, because I want to make sure that those in that age groups who have been diligent throughout this whole time, we would not diss them in this whole thing, saying, you did a great job, keep up the great job. And furthermore, be an influence on those peers around your group to say, you really shouldn't be doing this. This is really not a good decision. And that includes those in post-secondary school institutions that are attending, saying, we can have a good time, but we shouldn't do it this way. And we should make sure that we are attentive to these measures and protections. So I want to be very targeted on that messaging, Mike.
Follow-up?
On a slightly different topic related to schools, what will be the protocol for schools when there are confirmed cases discovered in the classrooms, whether it's among teachers or among students? What's going to happen in terms of people being notified and direction to people to isolate, or even schools to be shut down? Do you have a sense of what will happen when there are confirmed cases in the schools?
Right, excellent question. And we have put that down. We're working on a joint updated playbook with the Ministry of Education so that the school boards, the principals and staff know they'll answer those questions. We want to get down in a platform that the parents, as we go through our education process with the parents, so that they can say, just like yourself, what happens if this, and then this, and then this? What should we expect to happen? As I said last week, our approach will be consistent as we have all the way through. That if we identify someone with signs or symptoms that is a suspected case, that person goes into isolation, that person is tested as quickly as possible and assessed. Their contacts are identified in our cohort system, whether it's a classroom or cohorts within there. We will then note them that we may say we are under investigation, but you're doing self-monitoring. Anyone else ill or not ill in that classroom? If the test comes back negative, we're okay. If it comes back positive, then that's a case. That means those in that cohort, family, in the cohort in the classroom or the cohort in the secondary school, you are now contacts of that case. Now you have to be tested, and you will have to be in quarantine for the period of time until your test results come back. If they come back negative, you're in the clear. If they come back positive, now you're a further case, and we go on that. If you find a number in a setting where it's not confined to classes or cohorts, then you say, the happenstance of having 2 or 3 cases in even a large high school seems unlikely. Does that mean there has not been adherence to public health measures? There's not been adherence to cohorting in classes? Can happen. Then you may say, maybe we should suspect there could be an outbreak in that institution, and maybe we need to test everybody. And that means then for a period of time, that institution would not be open for the time of testing, in order to say if they came back a lot of positives, you can quickly contain and wall that off as quickly as possible. This is not inconsistent with what we've done throughout the whole COVID response. And that's why we said what we've done in stage 1 and stage 2 and stage 3, what we're doing with these outbreaks in Ottawa, Peel, and that, we're following the same pattern. And the public have been used to that and saying that is consistent with what we've done before. And so, but that means then, if you know the scenarios, how are you going to plan as a parent? How are you going to plan as a teacher? How are you going to be kept informed? How are we going to make sure they're knowledgeable of that and kept up to date as soon as possible? How are we going to do testing in a very consistent, efficient, effective way and get answers back to the school, back to the teachers, and back to the parents as soon as possible, and the students, of course, so they can be informed what to do. So this is our challenge. We're putting that all down, and we hope to be able to have that rolling out both province-wide at local health units with the school boards. And so the parents and family and teachers are hearing the same message from different groups in the same way. So we got to be really consistent on this as we go forward.
Next question.
Next question comes from Rob Ferguson of the Toronto Star. Please go ahead.
Hi, Doctor. Just want to follow up on something I was asking a couple of weeks ago. It seems that people's social circles, their bubbles, have completely burst. All sorts of people are having more than one circle at the same time and are, just associating pretty freely. I'm wondering if you think that is reflected in the slightly higher numbers lately, and what your message is to people right now with kids getting ready to go back to school on the social circle front.
Right. And thank you for that question, Rob. I know this has been an issue and I've liked your support for that all the way through. We wanted to have our stage 3 out and running for 2 or 3 weeks to see how people handle the broader public health measures, the 50 indoor, the 100 outdoor, et cetera. And so I've asked our team, and they're looking at that right now of how we do it. I think what you're seeing and what I've been seeing is that people who have seen the bubbles or cohorts or social circles see the merit in that. Some are doing their own, whether it's bubbling up, some are creating their own new bubbles in that. Some are actually shifting and saying, okay, I'm going to quarantine for 2 weeks and then go to this group. So people actually have become fairly adept at doing it as compared to one saying, disregard it, do whatever you want. And those are the ones where we see the outbreaks in the backyard parties and things like that. I think what I'm asking our public health measures table to say is the next phase in large circles or in large number of circles. And my sense is we're probably going to the latter. That means if you've been good at monitoring your one circle, how can you do a 2, 3, 4, or 5 circles? Because if you get the drift of it, in the schools we're saying your grade 3 child is in a cohort, your grade 6 one is in another cohort, and you are in one and you may be in 2. So as a parent, can you keep track of all 4 or 5? In the fact that if there's a case, was it your home cohort that did it? Was it the school, this one or that one? Or some other thing as a cohort? So the aspect of that, can you document that and note that? So if we find a case, we can quickly ask and wall off the saying, this was not related to your family cohort or your social cohort or your work cohort. It may have been related to your child's activity cohort. So I'm asking the public health measures team to look at that now because we want to set that up and ready for school because that's what we're going to be doing. And if you have multiple children in, you've got multiple cohorts to manage. And how's one going to do that? So that as a parent, you have a sense of where your child has been exposed. Home, whether it's in your home immediate family or with some expanded family members, or whether it's in grade X or Y, and how you might do that. So, because a parent, you want to know, just like you would normally with their activities and the socialization, who have you been playing with and who have you been doing things with? Because there's something concerning you, you'd like to figure that out. We would like you to figure it out. We want to work with you on this. That's why we're doing this on a go-forward basis. That's why we're setting up all this program with our public health nurses, and we want that understood. So it's a very good question, Rob, and we want to see that expanding out as people may say, I can deal with 4 or 5, or some may say, no, I think just 2, or some say, I'm just staying with what we've got. That's what I feel comfortable with at the moment. So we're trying to look at how our measures table could put that out in a way so people aren't doing it spontaneously, as you're alluding to, but could do it in a planned way. And what I've seen some doing it, I think they've done it very much with in consideration of public health measures. So they've been saying, we're going to run it like this, same as the other one. And I applaud them for that because they say, I know who it is. We're all being careful. We're being responsible to each other. We have a trust with each other, and we understand that. So I see the pressure to do that. I think that's only but relevant, and I think if we can endorse that with a model or a program, that would be stronger. So I'm asking our measures table to come forward with some recommendations in that context that you've alluded to.
Follow up?
Yeah, thank you for that. Just a quick follow-up. So would the circles, more or less, you'd want them to stay 10 people?
Well, I've given them 2 options, either, and I think the pressure I'm seeing that people, while they may want to go beyond 10, they'd like to have 3 groups of 10. I'm getting that sense. And of course, you can't have, there's a cohort of 10 or 15 or whatever kids at the schoolroom, you can't include them with your 3 kids at school. It means you have 3 cohorts differently. So you can't have a group of 70 in there. You want to say, this group was meeting, that group was meeting. So if there's a case in this one, and where did they get it from? So we want to be able to track that back, because you can imagine in a classroom, if there's a cohort of 15, each one of those could be connected to 3 or 4 other cohorts in the family, social, whatever. And so you'd want to say, besides having the case in the school, if the child is positive in the classroom, they got it from somewhere. If the child and everybody else in the classroom is negative with no signs or symptoms, then they got it from some other cohorts. What are those cohorts, and how quickly can we wall that off to limit that and be certain to assure the other parents that their children were not involved in this at all?
Next question.
Next question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Good afternoon, Dr. Williams.
Hi, Sean.
Wanted to ask you today about a letter that the Registered Nurses Association of Ontario sent you recently regarding the back-to-school plan. They have some concerns and say that they can't support it as it currently is constructed. And specifically, they asked the province to cut class sizes or cap them at 50. I'm wondering if you support that call, and if not, why not?
Yes, I saw the letter. I think it was dated the 19th, so it's back a while. And knowing Doris, and we did have a chat with RNAO and with Doris Grinspun, seeking their advice on our public health nursing, our nursing for the public health units, and strong endorsement, and agreed to help and assist us in that. So we really do value the input from RNAO in those aspects especially. I think on the aspect around the class sizes, we've always been strong in public health on cohorting. We haven't got into the actual saying whether that equals class size or not, because that tends to be more of an administration matter with the boards of ed and with the ministry. But we're more interested in the size. If they actually be the same, that's great. But as I've alluded to just with Rob, of having our cohorts of a size that we can work with is a good one, and we'd like to do that. But we've looked at all the points that RNAO emphasized. One about there's the distancing. If you can't do the distancing, can you do the masking? If you can't do the masking as well, can you do the cohorting and different hand hygiene methods, staying home if you're sick, all the case contact management, timely and effective testing and response building. All these are part of that, and I think I applaud them on the fact they took a comprehensive view. And even between then and now, I think RNAO has heard some new comments back from the Ministry of Education on some of those things that they've implemented even in the last 3 or 4 days, and looking at how they're going to look at different boards of education and how they're handling that. So I think what I endorse is that the enriched discussion around it, and they're not the only ones putting their commentary in. We have many other experts that are looking at in this live time discussion of what is the best way to do it, knowing that no jurisdiction up till now has done it really successfully, except in very small, isolated areas. And so we're all in this together to drive for success. And so the more expert inputs we get, the more we hear those, the more we incorporate, we think about those. So thanks to Doris Grinspun and the RNAO for putting their comments in. And they're not the only ones. We have lots of great input in the matter as we are all endeavoring to do the same thing. Have the children back into the school experience with that need of the risk of staying out too long. We've heard from the experts on that. But how do we do it in as safe way as possible? Is it risk-free? No. School is never risk-free in some sense, but can be risk-lowering, can be risk-contained. And that's what we wanted to have the partnership with public health, with the parents, with the teachers, with the students, with the boards of ed, and with groups like RNAO and others, and with the relationship with testing centers and primary care physicians. How do we endeavor to do all this together? Because we all feel it's important. Safety and learning and social experience of our children is a very huge investment. Together, I think we can do a good one, but we all have to work hard at it, because it won't come without its hiccups and bumps, but we're going to deal with those as we do, because we're going in prepared for that.
Follow up.
Dr. Williams, I wanted to follow up. I wanted to ask you about one of the other recommendations the RNAO made. I spoke with Doris Greenspun today, and she said that they'd also like to see student aged 3 and older all wear masks in school. I'm wondering why that isn't part of the province's plan right now.
So we looked at that very carefully, and we asked all our science and modeling people, as well as experts, even at different levels, knowing that the level of infection and transmission is different under the ages of a grade 4 and under grade 4. And so we tried to understand that. We looked at the aspect of adherence to wearing masks, the ability to wear masks, the emotional impacts of wearing masks, knowing that while we could ask grade 4 and above, make it mandatory to wear, If you're making it mandatory under grade 4, how are you going to enforce that? What are you going to do if a child is emotionally traumatized with wearing a mask? Are you going to force them to leave the classroom? Are you going to have some discussions on there? We would like it, strongly recommend it, and I know a number of young children who are okay with wearing that, and one will be, and one may not be. And the thing is that in that younger age group, we don't want to make it a traumatic experience, but we will encourage it. But if you make it mandatory, then you're left to enforcement. And I don't think they mean like you're going to march a 3 or 4 year old out of the classroom and not allow them to attend ever. I think it's a matter of trying to work with it and seek to get some reasonable ground of participation. So would I accept that maybe some grade JKs or SKs, all of them are wearing masks? I probably will see that. Does that mean 1 or 2 children may not either be able or not capable of wearing one? They may have a health condition they can't wear one. So we're going to have to be flexible and work with that in a reasonable level of risk and understanding. So, and again, we're worried about the emotional, the psychological, and those other aspects of a child's experience in the school as well. So it's a balance, and we're trying to weigh the science, the evidence we've seen, experience, combined with as many measures we can put in place that would guarantee as best we can a safe re-entry back into the school system and monitoring it.
Next question, and this will be the last question.
Last question comes from Randy Rath from CHCH TV. Please go ahead.
Hi, Doctor.
Hi, Randy.
I'm wondering, when you look at the return to school from 10,000 feet, is there something that you think is particularly difficult? Is there something troubling? Is there an aspect that's very challenging that keeps you awake at night?
My main thing that I want to make sure is that everybody is informed. That means there's an educational standard. Much like it took us a while to make sure everybody within the long-term care sector was understanding infection prevention and control, because everybody has to do their part. And so I think this time we have to get the materials together to carry out that education stuff as a ground zero to start with, so that people are coming in not with probably every one of their questions answered, but certainly that they're thinking about it, because there's right now a very good, robust social dialogue going on. And that doesn't bother me. I think that discussion needs to take place, because without that discussion, people are saying, I'm not getting my answers. I want to talk about it further. I have one answer, and now I want to hear it from 3 or 4 different people. Is it the same answer? Because as a parent, and that you want to be convinced, or as a teacher, you want to be convinced, am I sure that the risk is what I think it is as it's portrayed to be? So I'm not too worried about that. The one that I want to make sure is I have enough time and enough resources in that to allow that robust discussion to continue, because we've seen the value of that in Ontario. That's why we flattened the curve. That's why people continue to wear masks in public places. Not everybody, but the majority do that, because we've allowed that to percolate through and deal with that. And now we're rolling that into the school setting. And I want to make sure that we've covered that adequately as we're carrying that out. So always public awareness, public knowledge, public's understanding, and their own risk assessment of the situation, because it's ours in Ontario to own. It's ours in Ontario to do. And I want to make sure we allow enough time for that, because I think it can be done, but it requires everybody to be equipped and ready to do it. It's not just pass it over and hope it goes well. This has to be done assertively, consistently, again and again on a go-forward basis, as we've done all the way through our stages. We have not laxed our public health measures recommendations, and even now we're in stage 3. We say same things: distancing, masking, hand washing, hand hygiene, masking when you can't maintain the distancing, stay at home if you're ill. If you're concerned, get tested. All these things are still in place. We have not backed off those at all. And this is part of what I think our Ontarians have to say. This is going to be our new normal on a go-forward basis, including Rob's question on allowing some wider venues of cohorting, circles, bubbles in there, but still diligence in managing those, monitoring those. So it's a fair amount to ask our public to engage in, to embrace and understand, and some of those things that seem to be difficult to do at first are now becoming second nature for most people. And that's our task ahead, because it's not going to be over in September, October, November. We're rolling on well into 2021.
Follow-up, this is last question.
Yeah, another question. Every day when the statistics come out, we see the number of resolved cases. What does resolved mean? Are there lingering health effects from COVID, and is this something that our healthcare system is going to be burdened with for years to come?
Well, that's another good question. And I think that's part of when you have a new virus and looking at its impacts. And it's one of the warnings we're saying to younger people who may say, well, I had it, I got over it, it's no big deal. We are seeing some evidence and some anecdotal reports, but we're trying to get some collation on it. It's not huge numbers, but enough that back from 3 months ago, I've been asking our scientific table, what are the sequelae, consequences, of a post-COVID infection? Is it totally benign? Are there some ongoing ones in some individuals? Because it really does impact a lot of your immune system in some ways. How do we understand that? How do our experts understand that? How do the pediatricians understand that? I think there's much we still have to learn. So I'm saying to people, especially younger people who may say it's no big deal. The fact is you don't know that yet, and I can't guarantee that it's not going to be something in your case. I'm not looking at high percents, but it could be. Even though you felt that your initial case was fairly limited, I don't know those things yet because it's a new entity. We are still trying to ask our clinical experts those questions that you just asked me, and I'm still looking for answers on those. So I'd say be cautious, protect yourself, follow those on there. We know that people who have resolved have finished their 14-day period. We know they're no longer shedding virus. So their immune system has thrown it off. But does that mean any aspect to it in there, including what you're hinting at and what some have noted? Are there some longer term consequences? We hear reports of that. We need to have some better science and data on that to rule that in or out. So that's not the acute infection, but the chronic one that you're said there could be. And I think I need to be informed on that from our experts, as we all are across the country and internationally as well.
Thanks, everyone.